Hi, I'm Dr. Kim Byrd-Rider, and I'm a physical therapist and a psychologist. And today I wanted to talk about getting published because there's a lot of problems in the fields that are up and coming. They're complaining about not getting published, and those type of fields are people who are publishing about the chakra system, subtle energy systems, or acupuncture meridians and quantum physics type things, and they're wanting to get published in standard medical journals that are peer reviewed and have a very high, very stressful, high level entry system to get in, and they're being declined. But what I'm hearing them say is things like, they just don't like us. They don't like our topics. They're allopathic medicine, and they don't want to hear anything that has anything to do with other cultures and the healing arts and those type of topics. And you know what? That just isn't true. That's very similar to when I was had said, "Why are you getting a C in this class?" And I said, "The teacher doesn't like me. There's no way I can get an A because she just doesn't like me." Then, well, you know, what am I going to do? I'm stuck. I have to get published in these lower level journals that have less strenuous benchmarks for admittance. But then I can't get my product out to or my articles or my information out to the general public. I know why they're not getting published. There's two reasons. The first one is really important, and you can find these answers in marketing strategies and also just writing a good paper. Whenever you write a paper, you have to think about your target audience. You cannot write to other people who know about acupuncture meridians or want to know about acupuncture meridians, because you are writing to medical journals or for medical journals, and their clientele are physicians, healthcare professionals, allopathic medicine type people. And so they're looking for articles that appeal to that target population. You have to keep that in mind. There are 3 loopholes in allopathic medicine, and it's throughout our research. I say I am in the medical field through physical therapy and psychology, so I work in those fields. And if you oriented your research article towards those loopholes, you can get in because they're looking for solutions. So those 3 loopholes are: the first one is epigenetics. So I'll read to you the actual definition of epigenetics: of gene expression in the DNA due to environmental influences. That means we can change the DNA. That's really exciting. The environment changes the DNA, or the gene expression within the DNA. So there's certain genes that are either on or off, and your environment can actually change that switch from off to on. And say that gene is cancer protection, or, cell protection against a certain type of cancer. You want that gene on. And we're learning that through your environment you can do that. Now, if you could angle your article about the subtle body systems or the chakra system and how it applies to epigenetics, that would work. The second route is the placebo effect. That's huge. That has to be a variable in all research work because we know it exists. We know it exists, as we've got tons and tons and tons of proof that the placebo effect is real. And the definition of that is the placebo effect is the beneficial effect due to the patient's belief in the treatment. 33 to 38% of all allopathic medicine positive outcomes are due to the placebo effect, according to which research you read, but it's somewhere in the 30 percentile. That's 1/3 of all positive outcomes from allopathic medicine, whether it's taking a pill, surgery. So they've done research where they did surgery on 2 people. One person actually got the surgery, and the other person, they just cut them open and sewed them back up. They didn't even do the surgery, and they had the same outcomes. The person who did not have surgery and the person who did have surgery. And that's the placebo effect. And that allopathic medicine buys into that one. So, what is the placebo effect? Your belief system? That could be psychology. That could be the chakra system. That could be the subtle body system. That could be, quantum physics, all of those topics. If you set the article up to appeal to the placebo effect or present a solution or an explanation for the placebo effect, that's convincing to your target audience. If your target audience is the medical community. And then the third way in is neuroplasticity. So neuroplasticity is the concept that the brain changes itself. That's a book called Neuroplasticity, the brain that changes itself. But really what it does is it rewires itself. So say a person has a stroke and a little area of their brain dies. It dies. And so they're not able to use their right arm because of the death of that area of the brain. If you keep using that arm over and over and over and over and over for months, maybe even years at a time, the brain will recircuit itself to use other areas of the brain to use that arm. And if you're interested in that concept, I recommend that you read The Brain That Changes Itself by Norman Doidge, who's a physician, just riddled with research. So we know this one to be true as well. We used to think the brain was static. It was locked in. Okay, so now it changes. How does it change? That change? What affects neuroplasticity? How can we get neuroplasticity to happen? So if you're writing an article on the chakra system, the subtle body systems, whatever, if it's a new concept, a quantum physics concept, and you angle it towards neuroplasticity, now you've got a hook. Now you've reached your target. There are lots of peer-reviewed journals on neurology that would welcome that type of information on that topic. Now, how do you title an article like those articles? You don't title them, "The Chakra System, See How It Changes Your Life." It's not going to work. You would title it, "The Placebo Effect, One Solution," or a new approach to the placebo effect. And then you start your by explaining the placebo effect, discussing the problem with it, and then going into your solution, whatever your topic is. And then that's how you've got to angle it correctly to get that particular journal to realize that their audience is interested in this topic and how it relates to them. They have to figure out how it relates to them. So the question is always, so what? So why does that pertain to me? So why should we be looking at this information? And if you want in those articles, you have to answer those questions for your target population. It's very simple. The other issue is the quality of the research article itself has to be up to par. If you read peer-reviewed journal articles and then you read articles that are coming from alternative medicine journals, they're different. Their standards are different. many times you'll see an absence of the methodology. You'll see an absence of a control group. You'll see an absence of statistical analysis. The statistical analysis is very complicated to do, and all variables must be covered. It is a thorough process that takes years sometimes to accomplish for one article. You have to have a certain amount of participants, and that has to be researched, exactly how many participants you need to get a statistically significant outcome from this. And so all those quality measurements, they have to be there, or you will not get accepted into a peer-reviewed journal. It's just that hard. And that's okay, because you can do it. It can be done. Don't give up. No blaming, no pointing. They just don't like me. None of that. Remember, do the work. Do it at the quality that that journal requires. And then make sure that your target audience is addressed. Their needs are addressed. Their so what questions in their head are addressed, because they can read about the chakra system and then they're like, so what? What does this have to do with my patients? What does this have to do with Parkinson's? What does this have to do with muscular dystrophy? What does this have to do with my patient population? How does this help me? If you can guide those solutions towards those answers, then you will be embraced and welcomed into the fold. So, and we want to see your articles there. We just need to make sure that they're of the right quality. And also, if you're writing that, if you say you're a research person on the particular system, like I'm just going to use the chakra system for an example, on the chakra system, and you want to get into a medical journal, it's a great idea to co-author with a physician, because these journals are also going to look at you as the author. You are going to be scrutinized. Are you qualified to write on this topic? Well, you're qualified to write on the chakra system, but you're not qualified to speak to medical physicians or medical professionals. You have to have an equal degree or greater to educate the level of people in the audience, the level of people of the readers. So pull in co-authors or editors to edit your work and put their name on it. And if you're writing a paper about neurology, oncology, a specific field in medicine, make sure you have a physician or a person who that's their specialty. That's what they've done their whole life. That's where their credentials lie. And then you team together. And because they're part of your team, they're going to edit your work as well. And that's going to, it just brings it up a notch, definitely. And then also remember, I'm going to add this last little bit about neuroplasticity. Neuroplasticity is an electrical system. The neurology is an electrical system. So action potentials that fire neurons it's measured in volts. So what else is measured in volts? Voltage. Electricity. Batteries are in volts. And so neurologists and people in neurology recognize that they are in an electrical system. If you can route your research to prove an electrical change to the environment of the body, and then follow your proof of how that has the possibility of changing the electrical system of the neurons, then you can find your way in. Do you see how I'm moving? I'm moving from your topic, from this topic that you've been working on, that's on the frontier. It's amazing. It's beautiful. But now you've got to do an apologetics of how does that connect the dots to what already exists in the world of allopathic medicine. And then you have to prove, so what? How does this help? How does this change? How can it be applied? And once you get all those pieces together, you'll be accepted. And when you're accepted into those journals, it'll be a great day. You will be helping to move forward. They're ready for it. They're looking for it. They're primed for it. But it has to be written just so in order for people. You are connecting the dots for them. Don't expect them to connect the dots. Don't expect you to lay it out there and then them go, gee, you know, I think I could apply this here and there. And then, you know what? That would affect this and that. No, that's not their job. As the article writer, as the presenter of this information, it is your job, the author, to not only pull in the background of the people you need to convince them that what you're saying is valid and true, but then you have to present it on this beautiful plate, laid out perfectly, explained perfectly, and then you have to explain to them why they're eating what they're going to eat, why this is important to them and the people in their responsibility. As I walk through these articles, sometimes I see that the author has just laid out the information and not followed through with all of those things. I would love to see this happen, and that's why I'm making this video. And hopefully people will watch it, move forward, and, you know, make this happen for all of us. We really want to see it happen. So good luck to you. I know you can do it. It's going to take a lot of hard work. You're going to have to work twice as hard as you're working now. You're going to have to collaborate, and that's okay. You'll be the better for it. So thanks for watching.